Just 1 second. Okay, good evening, colleagues, and thank you for joining the Champions webinar. Just some of our usual housekeeping. Please, if you could keep your mics on mute, unless obviously you need to speak. Please do use the chat box if you have any questions or comments. You can also use the chat box to indicate that you'd like to voice a question, or you can use the virtual hand as well if you've got a question. The call is being recorded, and that's just for accuracy and minutes purposes. And the agenda I've posted in the group chat. Just a slight change to the agenda per normal. Dr. Modupe Omenuju is going to be joining us a bit later to give us a COVID update in terms of the dashboard and figures and data. The agenda, as you can see, it's on there. Intro and welcome. Some feedback from yourselves. I'll give you a bit of context about that. The Champions review, and then license COVID update, the Q&A, any other business, and then the date of the next meeting, which is Wednesday, the 18th of August at 6 p.m. So I'll kick off. As per usual, just want to thank everybody again for giving up your time and joining the Champions webinar. Obviously for the benefit of your communities and the people that you actually work with. You know, it's not easy turning up every fortnight on a Wednesday evening at 6 o'clock, particularly when lots of things are opening up. It's probably more things for you to do. However, you're still turning up. So we just want to thank you for your commitment and your continued effort for that. As I said, the first agenda item is just really, we just want to hear some feedback from yourselves. Now that we're 3 weeks into step 4 of the roadmap, I know when we met prior to the 19th of July, some of yourselves were really nervous and conscious about the impact lifting some of the restrictions may have on particularly the vulnerable community or vulnerable members of the community. Now that we've gone into week 3 of restrictions being lifted, would anybody like to share what some of those concerns are? Are there still any concerns out there? Are there any fears? Are there any issues? I'll just open it up. Sue, are you trying to speak? We can't hear you. Okay, I think Sue may be having some technical issues. Is anybody else that would like to comment? Any issues and concerns that you may have, that you raised previously to restrictions being lifted?
Habib,
yeah,
it's Sai Naskari here.
Yeah.
I can see that Sue may be logged on through 2 devices. Maybe she could choose one other laptop if she's on the phone. But one of the devices is now gone, so maybe Sue's back with us.
Yeah. Sue, are you back with us?
No, she's left us now.
I think she's having a connection. Yeah, connection.
Yeah.
Okay, so I think there's a comment there. Nina's made a comment. Some people are still worried traveling on local transport when people not wearing masks. Yeah, Sue's trying to come back in again. Yeah, that still is unfortunately, that still is a concern. Masks unfortunately isn't compulsory. Some people choose to wear masks, others don't wear masks. So we've got Sue back now. Sue, can you hear us? Okay. Okay, whenever you can hear us, Sue, just come in. That's not a problem. Make your comment. There's another comment in the chat. Yeah, unfortunately, yeah. I mean, in terms of supermarkets and shops, certain areas you can go, and some people are still they're still confident in wearing masks and they prefer to wear masks, whereas others, they don't. Okay, Sue, this is Sue Gorgon. If you can, if you could email me, please drop me an email, and I'll arrange for lateral flow test kits to be delivered to your church. Saeed, if you could put my email address in the chat, please, and then see if you could email me your details, and I'll sort that out for you.
Certainly, I'll do that in a minute.
Yeah. Okay, Sue, do you have a comment? You had a comment to make? You say your audio is still faint, but go for it. No, we still can't hear you, still, unfortunately. Okay, Nina's asking a question. Local worship places arranging coach trips to seaside. Is this okay? As some people are asking, should they travel or not? What can they do? Yeah, legally they can arrange trips, and you can go to the seaside. There's no restrictions. However, I think it's up to each individual to make that choice, that conscious choice. You need to do your own. It's about personal responsibility and doing your own personal risk assessment. Think about the risks that are pertained to actually traveling. Who's on the coach? Is it people that you're familiar with? Is it people that you know? Do you know if they're vaccinated? Where is it that you're going to? Where are you coming back to? Are you coming back to a house where, or wherever you live, are there vulnerable people there? So all of those questions you need to ask yourself before you decided to go onto that trip. So almost kind of like your own little personal risk assessment. If you feel comfortable in traveling, by by all means travel. But if you feel that you could be putting yourself or somebody else at risk, then you need to decide whether you go or not. Our nursing homes are autonomous as to what they choose to do. Local one to miss. No, that's certainly not the case. They may have done a risk assessment, and probably within that risk assessment is probably too much of a risk to allow people to go in. So they still have that personal responsibility. So that could be the reason why, but they're not autonomous in any way whatsoever. It's just that they probably, like I said, they've done a risk assessment, and it's still probably the people that are in the nursing home may be really vulnerable and at risk. So they choose not to put those people at risk. Okay, anybody else got any other questions or comments or issues? The first question that I asked was around now that restrictions have been lifted, what are some of the concerns, or are there any concerns that you're seeing in your areas or communities that you work with?
Can I just come in and put the questions in there?
Yeah, go ahead, Nina.
Some worship places are opening up with this, but also some coach companies are doing it as well. But there's going to be a lot of people coming from different angles that you wouldn't know. And if the worship places or private people are arranging these trips and people are going, they wouldn't be in that position to ask, have you been vaccinated or not? Yes, you got to make your own decision, but these kind of things are open. But, I'm just thinking, where does that lead for obviously sometimes the cases are rising, but where does this leave us? Because we left people to do what they want to do, but at the same time, risk assessments got to be done. And some people don't even know how to do them because they're just going to maybe 2 people from one family, 3 people from another family they never met before.
Yeah, I mean, as I said, guide. Sorry, go on, Nina. Carry on. Sorry.
Yeah, no, I'm just saying I'm just concerned about this myself as well, that these issues are there, but what do you do in situation? People want to go because there's no restriction anymore. But when you're looking at a risk assessment on a coach, a 48, 49 seater, as a person, for example, I'll give you my example. If I went with somebody, I wouldn't be able to ask, well, have you been vaccinated? It'll be somebody who has arranged it, but how are they going to find that out as well? So we are leaving it ourselves. Yeah.
So so when I'm at risk assessment, I'm talking about you doing a personal risk assessment yourself. Obviously, the organizer will do one. I mean, there's nothing wrong with you. I'm not saying you have to ask people whether you've had the vaccine or not. If you don't know, you don't know. But what I'm saying is, if it's unclear, then it's better that you don't go. But unfortunately, there's nothing you can do to legally stop somebody arranging or organizing a coach trip to a seaside or whatever it is that they're going. You have to make that judgment yourself. You can speak to the organizer and ask the organizer what risk assessments and what measurements have they put in place. Before you decide to go, you can have a conversation with them, but not about necessarily who's had a vaccine and who's not had a vaccine. It's more around how safe is it for yourself. You'll have to make that judgment. Unfortunately, it's not the answer that you wanted to hear, but as you stated, with restrictions lifted, there isn't any legally, you can't stop anybody from organizing a coach trip or a bus trip, to a seaside or anywhere else.
Okay.
Habib, could I just come in for a second?
Yeah, go ahead.
Just to expand on your response, Nina, what it would be is that in London, the mayor has decided that in underground travel, which is very confined and close to each other, that everyone should wear a mask. So in your example, before you book the coach or agree to travel on it, you will be able to inquire with the coach operator what systems he's got in place. Is he asking all passengers to be vaccinated? Would he require all passengers to be masked through the journey? And then you can make an informed choice. But obviously, as Madhupe keeps saying in most of the seminars, that we personally, if we find ourselves in a confined space like a coach or a bus or a local train, we would have to take precautions and maybe possibly wear a mask and obviously keep the hygiene standard high when we return home. So it will be a personal decision that you would make. But I would agree with Habib, as he said, it'd be very difficult and sensitive to ask a fellow traveler, have you been vaccinated?
Thank you.
Yeah.
Okay, thank you for that. Someone's asked a question about, do we know how much the reduction in case numbers is down to schools closing for the holidays? If that's one of the reasons, will the rates go back up? We don't know. If I'm honest with you, rates are down, not drastically, but they are coming down. At the same time, testing is low as well. Testing is low, so that could be one of the reasons why case numbers are low, because obviously the more people that test, the more information, the more people that you'll know whether they're positive or negative. So that could be one of the reasons why the numbers are low. I don't know. It could be because of the schools. We don't know. However, in terms of COVID, the infection spread, one of the things that we do know is still is community and workplaces and people socializing, not necessarily schools. And in terms of schools, sorry, go on. And in terms of schools getting help to improve ventilation on their premises, schools have got adequate resources, and they're getting plenty of support to ensure that the schools will, when they do reopen in September, they'll be ventilated as possible, as weather permitting. Any other questions? Anybody else? Any other issues or concerns?
Could I just add to my question about schools?
Yeah.
It was prompted by a discussion I heard on the radio this morning, comparing the detail that schools were getting in, for instance, New York City, compared with the advice from government here saying, check your ventilation, whereas in in other places, apparently the Dutch and the Americans are giving schools much more advice. For instance, unblock your windows that have been painted up. All sorts of detailed advice.
Mhm.
Get a carbon dioxide tester, because if the carbon dioxide level is high, that's a sign that ventilation is poor.
Mm.
So I just wondered if Birmingham schools were getting more detailed information than the government is giving out.
Sure. Yeah, I mean, our colleagues from both obviously public health and environmental health are actually working with the schools. So one of the things I can say to you that we're piloting is the carbon dioxide test that you said. We've started to do that in places of worship. Obviously, it's voluntary. So we're asking places of worship when they've got the highest number of worshippers in their venues, if they want, we could come in and do a test. And as you say, if the carbon dioxide level is high, it will mean that ventilation is poor, and will advise those venues or those places what they need to do to improve ventilation. So yeah, we started the tests, and again, as it's on a voluntary basis, voluntary capacity, and environmental health colleagues will be working with schools as well to support them in terms of when they are reopening, ensuring that they're opening as safely as possible. Any other questions?
Zubair wants to say something.
Yeah, go ahead. I think he's on mute. Does Zubair want to say something?
No, I'm sorry. It's a error on my part.
Okay.
Sue is back with us. If Sue wants to try unmuting herself, if possible. Or if there's technical problems, Sue, you can type your question in the chat box and we will try to answer that.
Okay, whilst we're waiting for Sue to do that, if I just remind colleagues again, if I move on to the next agenda item, it was around at the last meeting and the meeting before that, where we had a colleague from University of Birmingham who is supporting us to review the actual Champions program. Because obviously what we want to look at is what's working, what's not working, how we can improve it. So you get the best out of being a community champion. And it was Dr. Amita Retsa that was actually doing the review, and she's having focus groups or one-to-one meetings to get your feedback. That's still ongoing. I'm aware there's a session this Friday at 4 o'clock if anybody wants to join. If you do, then please email me and I'll forward you joining details for that session. You know, please, we do need your help. We want the Champions program to work. You know, we are reviewing it, we are evaluating it. We want to look at what's worked well, what hasn't worked, and how we can improve it even more. Okay. I know quite a few people. There's already been 2 focus groups, and there's going to be, like I said, there's going to be a 3rd one this Friday. Just waiting for. Midupe has just messaged me. She's joining imminently, so she can continue and give you a COVID update with all the stats and figures and numbers in terms of where we are with COVID in Birmingham at present. Whilst we're waiting for Midupe, I will screen share and bring the figures up for yourselves. Hopefully everybody can see that. I mean, I'll make a start whilst we're waiting for Medupe. New cases and overall cases continue to decrease. The percentage of positive tests has also decreased as well. So as I said earlier, numbers are lower. However, the number of people that are actually testing is lower as well. So that could be the reason why, one of the reasons why the numbers are a bit lower. As per usual, we encourage all adults to do regular home testing using the rapid lateral flow tests. The test kits are available across several community sites, pharmacies, lots of places where you can pick them up from, places of worship. They're also free by post. If you go onto the Gov website, you can collect that. And as I said earlier, spread, a lot of the spread appears to be primarily occurring through household, social, and workplace interactions. Spread often happens in home, but it is inevitable. And there is that website, that germdefense.org is a really good website. Gives you lots of good handy tips in terms of how you can kind of like stay germ-free as much as possible. Hospital admissions range between 33 and 54 new cases a day for the week from 26th July up until the 1st of August, up until Sunday. Across the hospitals in the city, there's a total of 307 people, an increase of 3% compared to the previous weeks, which is 298. Unfortunately, there were 10 deaths from COVID-19 this week, up by 1 from 9 in the previous week. I believe that's Medupe joining now. Hi, Medupe, can you hear us?
Yes, I can. Can you hear me?
Yeah, we can hear you. I started. Can you see the slide?
Yes,
Yeah.
I can now. Thank you
Yeah.
very
No,
much. Sorry about that.
Not a problem.
I've just come off the youth champions.
No worries. I started some of the feedback, but you go ahead.
Oh, good. I'm happy for you to carry on, Habib, because if you need me, I can chip in. It's fine. Why don't you finish the feedback?
I only got to like the hospital admissions.
Yes.
So you want to continue from hospital admissions?
Okay, happy to, and please feel free to chip in anytime. Apologies, everyone. We had the youth champions webinar as well, so there was an overlap, and the young people had a lot to feedback to us. So we had to pick that up. But trust everyone is well, and as Habib has shown already, we're pleased to see the rates going down. The hospital admissions increased slightly to 307 across the city up until the 1st of August. And we sadly had 10 deaths. That's up by 1 death from the previous week. Shall we look into the next slide? Yes, so when we look at the cases by ward, so across the city, the number of cases, although they've decreased from 3,462 to 4,239 cases. All wards actually reported a new case, which is interesting because sometimes we'll have just a handful of wards, but it looks like all 69 wards had at least one new case of COVID-19. And that's also good because that shows that people are testing across the city. So thank you to the champions for reinforcing the need to keep testing despite the easing of the restrictions, and how it's even more important to test now because we're now going about and taking advantage of the new liberties we have. We need to really take personal responsibility and protect one another. The wards with the highest case rates, and these case rates range from 394 to 520 per 100,000 are on the list. Sutton Ready Cap, Franklin Great Park, Handsworth, Ladywood, King's Standing, Yardley East, Longbridge and West Heath, Garrett's Green, Bordsley Green, Soho, and the jury quota. And I think when it comes to the case rates by age, one of the things that we've been saying is that we have to always look at that with caution now, particularly as the children are on holiday. We know that we don't perhaps have as much testing going on in the schools as we did before. So that might account for why there's been a decrease in the cases per 100,000 in the younger age group. So although the cases in the younger age group appear to have decreased in terms of the case per 100,000, that's to be looked at with a bit of caution. We also noticed a decrease in cases across all ethnic groups, which is brilliant. So it shows that I believe, and that's what colleagues are saying as well to us from the NHS, that the vaccination program, which is ramping up across the city, is making a difference. And that's helping us to reduce the risk of ongoing transmission. But the inequalities that are there will still be important for us to highlight, because although the cases are going down, you still have these wards whose case rates are much higher than the case rates we have across the city, which is 303 per 100,000. So we are still encouraging everybody to remember to take the vaccine, to use their face coverings when they're in crowded places, to use hand washing and social distancing, just to continue to protect themselves whenever they go to places where it's overcrowded or they're indoors with very little ventilation, because COVID-19 is still very much with us. When we look at the vaccination rates, I think it's always very difficult when you look at it on a weekly basis, because sometimes you can't really see the difference in terms of the numbers. But generally, people are still taking the vaccine, although we know that there are those who are still hesitant about taking the vaccine and are unsure. And we know that we need to do more, particularly with the younger generation who have been eligible now for a while, to encourage them to take the vaccine. And it's about trying to reassure them about risks such as fertility, the concerns around clotting, myocarditis, and those things that have been on the news or on social media. And as the evidence is emerging more from trials, we can see that these risks are very minimal when you look at the risk of them contracting COVID-19 and the impact and the complications from COVID, like the long COVID, which is still a huge risk compared to the risk from the clots. And some of the risks from the clots are so rare that when you compare them to the impact of COVID on people and the risk of ending up in hospital or sadly dying, it's not worth that risk. So it's just weighing up the risk against the benefits really now, and for each individual to make that choice, not just for themselves, but for their households and for their wider community. So we are hoping to do more sort of question and answer sessions, awareness videos, and anything to just listen and encourage people, hear concerns that people may have, and understand what we can do to reassure those who are not sure still about taking the vaccine. The other thing to highlight is those who work in health and social care will be offered their booster doses, as well as the older generation who were on the priority list on the JVCI. So there's a need to do more to encourage everyone and to understand why people may not want to take the vaccine. And I think the list has gone down, reassuring me, of those wards where the uptake is much lower. So if you go on to the last slide, it says on there that up until the 1st of August, the wards with the lowest uptake are in Handsworth, Ladywood, Neshells, Bodsley Green, Soho Jewry Quarter, Balsall Heath West, Spark Hill, and North Eggbaston. So it's good to see that that list is reducing. And I think at this point, happy to take any questions. I'm sure you've seen on the news this evening as well, the announcement about vaccinating 16 and 17-year-olds. So there's quite a lot going on around vaccination and protecting everybody as we take advantage of the freedoms. Thank you, Habib.
Thank you, Mudib. I think you've answered Sylvia's 16 to 17-year-old question about the jab. There's just one from Deborah around if the waiting time is still 8 weeks between for the first and second jab, is there any way you can reduce that? Because obviously children, young people returning to college and stuff within 6 weeks? Would they need a second?
That's a good question, and I've seen that we've had, for example, a query came from a group that were planning a school trip, and they wanted to do like an early vaccination because the children or the young adults, they were going abroad, and the period where they would be away was when they were due their second doses. And we contacted the GP at the time to ask for advice. So I think it all depends on the individual, and the NHS, I think, have to assess and make a decision based on the risks and other factors. So if there's anybody who is in that sort of situation, I would say it's looked at on a case by case basis rather than a blanket rule to say, oh, let's vaccinate all these children before the dates when they have to return. So that's what we've been told when it comes to early recall, as we would call it. It would have to be based on individual need and that risk assessment and a discussion with the GP.
Thank you for that, Modipe. Deborah, hopefully that answers your question. Any other questions with regards to, okay, does more work need to be done and encouraging people to do the lateral flow tests?
That's a brilliant question. I mean, as I mentioned earlier, it's very interesting because this report we just looked at shows that every single ward, so the 69 wards across the city, had at least one person test positive for COVID-19. That shows you that there's testing going on across the city. I think people are aware of lateral flow tests and they are doing them. We definitely need to do more to continue to encourage people to take the test, because that's the way in which we can stop the spread, as well as the vaccination. As we know, vaccines don't stop you from getting COVID. So our advice would be definitely to do more to encourage people to take lateral flow tests. The only other thing to remind us of is that those tests are not to be used for people who have symptoms of COVID-19. That's the PCR test. So these are more for asymptomatic rapid testing to make that decision about whether or not you should go about your business and interact with people.
Thank you, Modipe. Anybody else? Any other questions in regards to presentation before we move on to the next agenda item? Just looking to see if there's any hands up or anything. Anybody got their hands up? Okay, Sylvia, go ahead. Unmute yourself, please, and ask your question.
What it is, what's happened is we've been pinged in the family. There's 3 of us that's been pinged, and we've actually tested ourselves twice a week. And we've contacted Test and Trace, and they says we wanted to know if we could actually go out, and they were saying that it wasn't compulsory that we had to stay in, it was advisory. So I wanted to find out what the actual procedure is in terms of actually going out, because we're actually isolating even though I test twice a week.
That's a very good question, Sylvia. So can I just check, was it that someone was identified as a contact, or that they tested positive?
It was that someone was identified as a contact, because in just 2 weeks, I've had to isolate, my husband's had to isolate, and my son's had to isolate. So we're actually being cautious by not going out and doing the 10 days, but we were told it's advisory, because we've actually tested ourselves and we're all negative, and we test quite often. Actually, it's more than twice a week. And my husband is still waiting for support financially, because he's missed out on his work. So it's not really an encouragement to know that they're saying you're going to get support and you haven't. So there's a temptation to not actually stay in, but we're doing the right thing. And that's 3 of us in the household that's actually isolated for 10 days. So there's no holiday we've actually had.
Yeah, I'm really sorry to hear that. So I think it's always very tricky, isn't it? Because it's the difference between the should and could and may or must. And
Yeah.
and when you look at the current NHS, the link on the NHS website, which I think we put on the chat the last time we had the meeting, it does say on there that the way it's worded, it says, I'm just going to read it out, how long you need to self-isolate. And then it says when to stop self-isolating. And then there's a bit where he then talks about if the test and trace service contacts you, it's a legal requirement to self-isolate.
Right.
So I think this is where it gets a bit tricky now, because as we've said before, we're at that point where it's down to personal responsibility.
Yeah.
And if you remember from the video that Dr. Justin Varney did, and where he's tried to plead with everybody to take advantage of the easing of the restrictions, but also remember that where we're at now, there's still so much uncertainty because COVID is still with us. I think for us as public health, and thinking about your role as champions and how important it is for us to give you the right messages that you can use as within your role, it would be advisable to isolate. I think and I think this is where the balance between making that decision and your needs, if you are suffering financially as a result of it and you're struggling to access the support, the isolation support, please let us know where the barriers are, and what we could do is raise that with the team within the council who's looking at that, because the problem is I think it varies from person to person in terms of eligibility, and we've seen that that's been a barrier in some instances. And that's why, for example, we've been encouraging our voluntary sector and our and other services that we've commissioned to give one-to-one support to families where people are unable to access support for during the 10 days. So there's that bit about it's personal responsibility, but also the legal bit, which I think is down to if the NHS test and trace service doesn't necessarily call you to say isolate, then it's not a legal requirement, but it comes back to we all have a responsibility. And if we're going to get out of this pandemic and get through this period without ending up where we did last year, then everyone needs to really be cautious about what do you do when you've been told that you're a contact, or where someone you've been in close contact with has had COVID, and you're a contact and you have to isolate. So I'm really sorry about the fact that it's causing problems for you in terms of managing that. And I think it's this whole thing about behaviors and changing behaviors and everyone taking responsibility for keeping each other safe.
Okay, thank you.
Thank you very much.
Thank you, Midivan. Sylvia, for your benefit, I have put some links in the group chat, sorry. There's one around staying home, one around the test and trace payment law, government, and then one about in terms of the local authority support payment. So I'll put those links up there. There's a quick,
thank you.
You're welcome, Sylvia. Question from Kerry. Can we highlight what we're doing about reaching people who may be hesitant to take the vaccine? I think many may need one-to-one conversations to explore and allay anxieties.
We agree with you on that. And just so you know, Carrie, we've been talking already as a team about organizing some more vaccination question and answer sessions and targeting that to certain groups that we can see from the data or from intelligence from conversations like this are still not sure. So, for example, we will organize events for people who work in social care. As we know, they may be having to be told that it's mandatory for them to take the vaccine going forward. We're waiting to know a bit more about that. So we need to support them in understanding where the barriers are and how we can enable them to make an informed choice. We're also looking at some Q&A sessions targeted at the younger people, where we know as well that the uptake has been slower in that age group, 18 plus. So when you compare the uptake in 18 plus to the uptake in the 50 plus, you can see a slight drop in the 18 plus uptake, which suggests that those within that bracket under 50s are still onshore in some places. And I think what would really help us as well, because we've considered this as well, is to have more people who represent some of those groups where there's more hesitancy, who have had the vaccine, to come and share their stories with us. So one of the things we've offered as an idea, which is something we've been toying with for some time and we've implemented in today's newsletter. I'm very pleased to say the team has been really responsive, and we've created a champions corner in the newsletter, and we already have had good responses from the group, with 1 or 2 champions sending their stories to us. We've published one today, and if there are any champions, who want to share their stories of vaccination, particularly if you were a champion that wasn't quite sure what was it that changed your mind, so that we can share those sort of stories, because there might be somebody out there who's going to hear that and make an informed choice based on that. So those are some of the things that we're trying to use. I think if you have any other ideas about ways in which we can support people and helping to break down those barriers, do let us know, because one of the reasons why we value this group is the insight we get from you and the role you play in amplifying the voices of the communities is as phenomenal and is invaluable in helping us to do our work and reach every single person and not leave anyone behind. So I hope that helps to reassure you that that's definitely something that we are keen to do. And these ideas we have, I think we're happy to improve on them. So do please continue to tell us and share those ideas with us.
I'm going to come to you, Mike, just to add on to what Madupe said, Kerry. We're also going to be producing some short video messages from influential people from within their own community. So whether it's a faith leader or an influencer or a community activist, those people that have had vaccines, just to produce some videos, so kind of like people within their own community are reassured. It gives them more extra reassurance about the vaccine and the importance of vaccine. We're also targeting specific events where we know a community may join or attend where there's a low vaccine uptake, and we'll have stalls there, and we'll have engagement officers there that will actually be speaking to people just to kind of like, hear what some of the concerns and what some of the issues are, and share some more accurate information with them. So just to add on to what Madupe said, we are actively doing, all the things that are necessary and all the things that we need to do to reach, particularly, as you say, those people that maybe, I don't want to use the word hesitant, that may be unsure and nervous, that need more reassurance. Mike, you want to ask your question, please? Unmute yourself.
Yeah, thank you. I was talking to a young couple this week who don't want to be vaccinated, and I asked why. And to be honest, I couldn't really ask the questions, but what they asked about is the risk of blood clots versus the risk of catching COVID. Now, are blood clots only likely to occur with the AstraZeneca vaccine or the Pfizer one?
You're on mute, Madupe.
Sorry about that.
No.
It's been over a year and that still happens. Sorry. Yes, you are right, Mike, that it's only with the AstraZeneca vaccine that there's this very rare risk of having a blood clot. And what is interesting is, and you'll find this within our vaccine toolkit, and I'm sure we'll pop a link into the chat because you can see firsthand the level of risk of clotting involved in various activities that we take part in on a day-to-day basis, which we never think about. We just carry out these activities. And so you, for example, will find that people or women who are on birth control pills are about 0.12% more likely to develop a blood clot. So that's about 1,200 women out of 1 million women will develop a blood clot from taking the birth control pill, compared to 4 cases in 1 million from taking the AstraZeneca vaccine. That's a risk of 0.0004%. Those who smoke, for example, you run a risk of about 1,700 people who smoke out of 1 million developing blood clots. And the actual risk from clotting, the actual risk of clotting from getting the COVID infection itself is far greater. I mean, the risk is about 40,000 times greater than taking the vaccine, and that's 165,000 people per million people infected will develop a clot if they got COVID-19 infection. That's a risk of about 16.5%. That's all in our vaccine toolkit, and that's the risk from the AstraZeneca vaccine. And so it is quite minimal. I mean, it's the WHO has actually even increased, I think, some of the data around that, and they've made it very clear that it's an extremely rare event. And what we've also been able to do is reassure those who may be at the risk from clotting, because the clotting events only occurred with the younger generation. And that's why they've been offered the Pfizer vaccine as an alternative to the AstraZeneca vaccine. So I think do feel free to share this toolkit with this people if you still have access to them. And one of the things we know with any new medical intervention, people will always have questions, people will always have doubts. There will always be the risk that one or two or even more people sadly will develop an adverse reaction to the medication. And that's what unfortunately has created some anxiety around the AstraZeneca vaccine. I was talking to a friend the other day and who said to me, have you ever looked at the paperwork inside the medical, what do you call the paper inside the box of medication? I forget what it's called. I used to know the name of it, but the paperwork inside a paracetamol box has a list of side effects that I've never really looked at before. I'd encourage everyone to have a look at that. And even something as commonly used or consumed as paracetamol has so many side effects that you wouldn't use it. I think one very common one is liver disease, which you wouldn't use it if you realize just how that can be a risk to you. But we still, quite a few of us will consume painkillers like paracetamol on a regular basis without really thinking anything of it, and we assume that we won't be susceptible to those side effects. But every drug will carry a health warning, and I just think we just need to reassure people and avoid delaying vaccination because of side effects that are really minimal compared to the risk of catching COVID-19 itself.
Yeah, for say a mid-30-year-old person, what is the risk of them getting COVID?
Oh, getting
in the
COVID,
UK?
high risk for all of us, I think. So COVID in itself does not necessarily discriminate by age, as we've seen on the dashboard that we've shared on a weekly basis with yourselves as champions. Anybody can get COVID. And if it's a 30-year-old, in that particular age group, we find that because they tend to be the more social or the working age group, there's a higher risk of them going into the workplace, perhaps being in an enclosed office or space with other people. And so at higher risk of being indoors in an unventilated space. So, it's got to be that anybody, I think, of working age group, which many of us are in the city, because we have a relatively younger population here, we need to be mindful of that, and that we do have that risk of going out and getting COVID. And if it's a 30-year-old who lives in a multi-generational family with older people or people who are immunocompromised or have underlying health conditions, then they also run the risk of bringing COVID back home to their loved ones. So I think it's looking at it in that sort of systematic way and understanding that the risk is not just to you as an individual, but to those around you who you really should be protecting as much as possible.
Right, thank you.
Thank you very much.
Thank you, Miripe. Any other questions? Just looking to see any hands up. Any comments in the box? I think Sylvia made a comment in terms of us maybe attending college and university open days, just to raise the awareness. That's a suggestion that we'll definitely take on board. It's something that we'll explore, Sylvia. If we can physically get there, we will, even if we can't physically get there. If we can virtually share information with or electronically with those schools and colleges, college and universities, we will do that. Any other question from anybody else?
I must say, I was expecting something on the travel restrictions because that comes up quite often. Everyone wants to know if there are any rules around amber, red, or green. So I'm assuming we're all staying. We're all having staycations, or we're staying at home this summer.
People are probably not confident traveling out.
Absolutely.
Oh, okay.
I think one thing that we did talk about was to try and understand. I don't know if you've touched on this already, Habib, because I was a few minutes late.
No, go on.
I was saying about the discussion we had around these meetings and the structures of them going forward, and the fact that there's a couple of focus groups going on at the moment where we've got the university. Dr. Amita is meeting with a couple of you, and thank you to those who have signed up to discuss the journey of a champion and what you think has worked well and what we can improve upon. And I just wanted to use this opportunity to thank you all and to encourage as many people as possible to take part in those focus group discussions, because we want to use the information you gave us to help us look at what we can do to continue to make your time here with us worthwhile. But beyond that, when you're not with us here, to make your time out in the community doing the amazing work you're doing more worthwhile. So I would encourage everyone to please, if you haven't, or if you know anybody you think is a champion and perhaps hasn't engaged as much and needs to have a chat with this independent reviewer to understand, for us to understand a bit more about what we can do to get more people engaged or involved, or to find out what people are doing when they're not here on the call. That would really help. And also we'd like an opportunity as well for, if there are any champions who, because I've seen that happen before, who want to share their stories even on the webinars here. I know you do that already through the questions or and things like that, but if there's anything in particular that you think you want to spend a good few minutes just talking about as a champion, do let Habib know, or let us know through the inbox, because what we can then do is have a chat with you about that and discuss how we can facilitate that in one of these meetings as well. And also, as always, we'll be sending out information to you about topics that you'd like covered beyond COVID-19, and so that we can reach out to various people in the community, as we've been doing, to come along and expand on that or discuss it in more detail. So I just wanted to say that, of course, do encourage your friends and families to sign up if they haven't already to the Champions Program, because the plan is to use this forum to continue to work with communities going forward. I think the impact of COVID-19 on all of us has been immense, but we haven't even begun to scratch the surface yet when we're trying to explore what people have been through and how we are going to support each other going forward.
Just a couple, thank you, Mary. Just a couple of comments. From Sharon, giving up on the idea of going anywhere. And then also Sylvia's asking if you give a bit of feedback on the young champions. Can you feedback on the young people? Yeah, the young champions, youth champions.
Absolutely. I mean, I do enjoy the youth champion. I think I enjoy all the champions conversations. I mustn't say which one's my favorite, but I think it just blows you away every time you join the champions call with the young people, because the questions that they ask and their awareness of what's happening, both politically and globally, is astounding. We have a very clever bunch of young people in the city who are passionate about not just now, but the future. And they talk a lot about the adults, actually, interestingly. They talk about the way they perceive. So today, for example, we had conversations about whether or not people were still conscious that COVID was around. Some reflected back that in some of the families that they're part of or wider relatives, they've seen that many adults have become a bit complacent and don't believe that COVID is still around. And some were more concerned about adults who have not been vaccinated, who are then not following rules or protecting themselves and loved ones. So we talked a bit about how to support people to still remain vigilant. We also talked about the vaccination and how we need to do more, exactly as we've said here as well, to support those who are still not convinced. We talked about cultural and religious barriers, actually, and they cited to me, I'm sorry about the noise in the background, there's an airplane. They talked about the need to work with elders, and that's the expression they use. In some communities, elders are very much respected, and they can be the voice and the amplifiers to reassure other members of the community to trust the vaccine. So we're thinking that perhaps we need to do some more awareness videos, for example, with older people in the communities reflected. Because I think they're right. We've done lots of things with day-to-day people. I don't think I've ever seen a video of a really sort of an elderly person sending out a COVID message or vaccination message. So that's something I think is a brilliant idea. They talked about long COVID, which I know we've also talked about here before, and the need for us to raise more awareness about COVID complications and long COVID and the impact on the younger generation, which is still emerging evidence. So we don't have a lot of concrete facts about that yet, but I think it's definitely a good idea to focus on that. And one last thing they mentioned, which I know we've also discussed in this forum, was the fact that the younger generation feel that they are strong and are so therefore not as risk of COVID-19 like adults are, and the need for us to do something around raising awareness about this risk to the younger generation. So overall, I think it's really similar to the kind of conversations we have here. They're very keen also to get vaccinated. They asked when they would be able to get vaccinated for those who were much younger. And we talked a bit about the 16 and 17-year-olds vaccine rollout, which was announced today as well. So overall, it was a really good meeting, very informative, and they really did show keen interest in supporting the grown-ups or the adults in their networks, which was really interesting. So if you have a COVID champion, a youth champion in your household, I apologize in advance if they're telling you off for not washing your hands, but they are very keen to support compliance with safety measures.
Thank you, Midipe. Any other business from anybody? Sorry, any other questions from anybody else before we move on to any other business? Okay, no other questions. So any other business? Anybody? Well, if you haven't got any, the date of the next meeting is Wednesday, the 18th of August at 6 p.m. I just want to thank you all again for your time and your continued effort and support in supporting us in kind of like addressing the pandemic and some of the issues that are actually been highlighted as a result of the pandemic. So I just want to thank you all for your time. Enjoy the rest of the evening. Enjoy the rest of the week.
Excuse me, Habib.
Sorry, yeah.
Excuse me.
Stay safe.
There's a very last question. Reg wants to know what's the address. I suppose he means the email address for youth champions if they want to join in.
Okay. I will.
We'll put that out in the newsletter, or if you've got it handy.
No, I've got it handy.
In an
I could do it now. I'll put it in the chat now.
Okay.
I'll put it in the chat now.
Thanks very much, Said.
Thank you.
Thank you for that, Said. Juliet.
And if anyone is unable to copy or note it, if they're on a phone or any other device, any email to Habib, you can get that replied back straight away if you need that address.
Yeah, it's Juliet. The person you need to contact is Juliet Faulkner. So juliet.faulkner@birmingham.gov.uk.
I think there's a C in there actually, Habib. I think her initial is in there. Hang on. Let
Is
me
it?
check.
Let me just double
Yeah, I
check.
think. Oh, yeah, it's Juliet.C Fox. Shall I pop it in there?
Yeah, go ahead. Yeah,
Thanks.
Okay.
you can. Yeah.
Sorry, can I just ask something about the community champions? After a meeting, probably about 2 months ago now, I mentioned it to someone I know in the Children's Trust and asked if they could identify, because they've got like, well, they've got like representative groups, probably of young adults more than older. They will have some older children as well. And he said he'd send it on to the communications team. And I'm wondering if you've actually had any communication with the Children's Trust about them identifying a couple of representatives on for the youth champions, because they, you know, for all things like that, you actually need a wide range. You know, if all you've got are young people in the sixth form of, you know, high attaining schools who are wanting to go on and read medicine, you can understand why it will be interesting for them, but they're not going to necessarily be able to make contact with other young people in cities. So you need a wide range. And I'm wondering if you've actually had any contact with anyone from the Children's Trust.
I have. I've met with the Children's Trust, and I've actually shared the information with colleagues within the Children's Trust, and not
that's
just that,
good.
also obviously within the education system as well, and also not just education mainstream, but also the PRUs. So students that actually attend alternate provision, so that information is out there.
Yeah, that's good.
And I totally, very valid point. I totally get that. I think obviously, you know, when we are recruiting not just youth champions, but also the adult champions, we want a representation from, you know, a variety of communities, not just from one community or from one area.
Yeah.
You know, we want the group to reflect our wonderful city, be it young people or older people. It needs to, you know, the membership needs to be reflective of the demographics of our city, both age, gender, as well as ethnicity wise. Okay, any other questions from anybody else? I'm just conscious of time. Okay, if there's no other questions, as I said, the date of the next meeting will be Wednesday, the 18th of August, 6 p.m. However, if there are any issues or concerns or any questions or queries that you have, you know, you got my email address. You can either email me directly or email us in the inbox. With that, please don't wait until the 18th. And everybody take care. Enjoy the rest of the evening. Enjoy the rest of the week. Stay safe. Thank you. Bye-bye.
Bye-bye.